Ladies and gentlemen, good afternoon. I'm happy to see all of you here at this forum. Health is a subject that touches all of us. I'm Assemblyman Alan Nakanishi. I'm a physician. I was a mayor, a city council member. I was the president of a large IPA of the Masters in Health Administration, and my goal 10 years ago was to go into health arena to help the issues in that arena. But as vice chair of the Assembly Health Committee and member of the Republican Assembly Healthcare Group, I've had the opportunity to spend a considerable amount of time on this subject this past year. Here is what the Sacramento Bee said under the front page heading in the forum, February 10, 2008. The death of healthcare reform. And under that heading, it read how Arnold Schwarzenegger's overhaul plan was doomed by the legislature's liberal and conservative partisan crossfire. Currently, as you know, the healthcare debate is being played out in the presidential campaigns. Much of the aspects of the Obama plan and Clinton plan is taken from the California plan. They all follow the model taken from the think tank New America Foundation. The Republican president's health care plan mirrors the California Republican Assembly plan, modeled on a market-based plan with tax incentives and tax credits to help citizens secure health insurance, and part of this will be encouraging health savings accounts. But let me go over the details of the plan. I'm going to go in 10 steps, right, of the California Health Plan. Number one, the plan mandates everyone to buy a minimum health care coverage. It requires that State Department of Management, Mr. Meb, to establish a definition of minimum credible coverage. Number two, it mandates guaranteed issues and modified community ratings in individual markets. What this means is that it requires that the health plan and health insurers not offer any individual plan that provides less than minimum coverage as determined by Mr. Meb. Number three, the plan increases the California Healthy Children Program, the CHIP program, up to 300% of federal level. Number four, it expands Medicare coverage to 19 and 20-year-olds at the present age of 18. It also expands from 100% federal poverty level to the 250% poverty level for these people. Number five, the plan eliminates the Medicare asset tax. Number six, it establishes a state diversity pool administered by Mr. Med. Number seven, it requires each health care service plan and health insurance to spend at least 85% of their premium dollars on health care benefits. 8, it requires prescription by 2010, electronic prescription, and it requires the state CalPERS plan to have electronic records by that time. What this means is that insurance companies cannot deny health insurance because of prior illnesses. 10 expands from 4 to 6 nurse practitioners a physician can supervise. It also permits a medical assistant to administer medication in settings outside a clinic under the supervision of a nurse practitioner. Currently, the law allows only a physician and a podiatrist this authority. It requires the California Health and Human Service Agency to soon lead in developing best medical practices standards for chronic disease treatment. And 5, it requires employer with one or more employees to adopt and maintain a Section 125 cafeteria plan to allow employees to pay premiums for health care coverage so that amounts are excludable from gross income. Now, as these bills came into being, the Democrats had the majority so they could pass that bill. But it also has some cost. When the cost bill comes to the state legislature, you need 2/3 votes. They don't have the votes from the Republicans. So their idea was, with the passage of this plan, in November of this coming year, they would have an initiative where the people of California would vote for these costs. It was going to cost about $14 billion, a fee of 4% of the hospitals, the 6% payroll tax, and a tobacco tax. The initiative was going forward, but because the plan failed a month ago, the initiative has slowed down. In conclusion, Health care will continue to be an important issue. There's much that needs done. We must assist the system to be more efficient. We must work toward electronic prescription and electronic medical records. We must do something for those who have prior illnesses to be able to secure health insurance. This means enhancing the programs such as Mr. Med. We must continue to work toward best practices to treat chronic illnesses, and we must emphasize preventive care. As we work to improve health care, it must be through a market-based approach with tax incentives and credits. It must not be through a government single-payer system and the consequence it brings. Thank you so much.
If you have any questions,